If you wake up in the morning and you suffer from body ache or stiffness in the body, in this video, let me share with you the reasons why it happens. What are the blood tests that we can do so that we can rule out the root cause behind this stiffness or pain in the body, and we'll share with you what are the things you can do or you should consider doing so that this problem subsides or will help you in the treatment. Hi, my name is Dr. Vivek Joshi. I am an Ayurvedic physician and welcome to my YouTube channel. If you are having pains in your joint, for example, knee joint or in your back or any other joint, and it happens only for half an hour, and this stiffness is only for few minutes, when you walk a little bit, then it subsides. The reason can be osteoarthritis. If the pain is in your back, when you wake up, your back aches a lot, you can't stand also, it's very hard for you to stand or to be straight in the morning, then it can be because of slip disc or protrusion in your vertebral column, in the lower part of your spine, means there is some damage. It can be because of any of the trauma. The trauma can be because of the heavy lifting of the weights or because of any of the accident. These things can cause the trauma, and that's why you have this problem in the morning. Now let's move towards the another reasons. In this list, first is rheumatoid arthritis. It's an autoimmune condition where your joints swell. If you'll touch your joints, you'll feel the pain also, and this pain doesn't subside within few minutes. It lasts for very long. It's a serious health issue. But yes, alternative medicine can provide you a big help in this. It's a serious health issue and the person should consult doctor if he or she is suffering from rheumatoid arthritis. Blood test that can tell you about rheumatoid arthritis. First is to give blood test for rheumatoid factor. If it is found in your blood, means the person is having rheumatoid arthritis. Second is to check for C-reactive protein, and the third one is ACCP. These two tests tells about the inflammation that's happening in your body, and they tell about the higher antibodies in your body. Second reason can be psoriatic arthritis. Psoriatic arthritis is related to psoriasis, that's skin condition. When it advances and goes up to your joints, then it creates psoriatic arthritis. Now, how to find out that a person is suffering from psoriatic arthritis? First, that he or she suffers from psoriasis. Psoriasis is a skin condition, and after this, if the joint also starts paining, then yes, it can be psoriatic arthritis. The test for psoriasis is skin biopsy. The biopsy of the skin is done, and this confirms that a person is suffering from psoriasis or not. Third is ankylosing spondylitis. In this problem, person suffers from constipation, morning pain especially. These things happen, but the problem is the reason is not clear, or there is not very specific test that can confirm. A doctor can confirm ankylosing spondylitis just by symptoms. And there is one test that can give you an idea, that is finding a gene. The name is HLA-B27 gene. This test is done if there are symptoms, and this test is performed and there is the presence of this gene in the blood. This can rule out that yes, this person is suffering from ankylosing spondylitis. It's not always that all the person who are having this gene, that's HLA-B27, they all will suffer from spondylitis. No, this doesn't happen, but it has been found that 80% of people who are suffering from ankylosing spondylitis, in their body, this gene has been found. So that's why there is a correlation, but it's not always 100%. So the symptoms and plus this gene, this confirms the diagnosis. This test just gives more idea to a doctor. Now let's talk about the treatment. In all the conditions that I have told you in this video, the first thing that I will recommend to any of my patients is vitamin D3. Vitamin D3 is going to help you in ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis, osteoarthritis. In all of these conditions, vitamin D3 is going to be very helpful and should be taken in a higher doses. Vitamin D3 will help. Second, my recommendation will be about digestion in all of these problems. If the gut will be healthy, then it will be easy to treat these problems. I have seen in many of my patients that these problems comes with constipation, and I start my treatment by treating gut. And I tell you, just by treating gut, I have seen tremendous results in my practice. So my general recommendation will be taking care of your gut. How you can take care of your gut? Just by eating more fruits and vegetables, eating your meal on time, especially your dinner. Don't eat after 6 p.m. If you are having body ache, then you should eat your dinner at 6 p.m., not late. And the herbs like Trifla or Bhumi Amlaki, they can help you in digestion. Trifla is mixture of 3 fruits. It gives you lots of antioxidants also. It clears your intestine also. So a good herbal combination to be considered. And the second herb that I can recommend is Bhumi Amlaki. It's the best herb for liver. It cleans your intestine. It helps you in digestion also. I'm not saying to take both of them. I'm saying to take one of them. The best thing about Bhumi Amlaki is that its dose is less, so it's easier to consume in comparison to Trifla. Trifla is also awesome. I use both of them in my practice. Dose of Bhumi Amlaki is half teaspoon 2 times in a day. 30 minutes after your meal, you can mix it with honey and you can eat it, or just mix it in water and drink it. Yes, it tastes a little bit like mud, but it gives awesome effect. So see how you are comfortable to use, but use only one of them. This is my general recommendation. I hope this video will be helpful for you. See you in next video with a big smile. Up to the time, smile more, stay happy, stay healthy.